Hello, and welcome. Today, I'm going to do a little bit of a video for everyone here to see my beautiful new medical bag. Alright, so I'm going to kind of take everything out of here and show you around. So first off, I want to note a couple of nice things about this bag from Lightning X. Is the patch here on the top is reflective, and you have nice big reflective zippers, so it's easy to find the zippers and get to what you need inside. There's quick access panel inside here. There's these pockets are all just one pocket. There's no divider actually in here, but as you can see there with the reflective blankets falling through, but it works, and it helps you to kind of organize your stuff and keep everything really good and quickly accessible. So of course I have my emergency mylar heat sheets up here to treat shock, and instant glucose for hypoglycemic patients. Then there's a nice pouch system here, which is really great because if I need something and I'm not the one grabbing it out of the bag, I can just say, hey, go grab, the red pouch or the green pouch. I don't have to explain to them how to find it. Just open up the pocket, grab the pouch. So we'll just start going through here. So in the back, I actually have my this is my folding North American Rescue quick litter. Over here, I have a 12x30 trauma dressing, and then this pocket is where I have all of my gauze. So there's every different possible size of gauze roll, from 2 to 6 inch gauze rolls, and then there's several 5x9 and 8x10 gauze abdominal pads. All my securings are right in front of that, all the bandaging, as you can see down in there. There's all the bandaging down in there. There's tape and the self-adhesive bandage, and of course waterproof tape, and everything's latex free, of course. 100% latex free in there. Then I got all my creams and stuff up here. We got Chigger X for chiggers. I do take this bag with me camping a lot, especially with the Boy Scouts, and so this comes in handy sometimes when a scout gets chiggers. And of course baby powder. I have just little Johnson's Walmart travel bottles, a couple of those. They're one use, so if a boy gets a rash or something, you hand it to them, they take it with them, and I just replace the bottle and they keep it, because that's a lot easier. Trying to worry about cleaning those. Then we got a spray, isopropyl, 50% alcohol, calamine lotion for poison ivy, need to say more, Bactine for cleaning their little cuts and scrapes that they get. It happens a lot, so I use that a lot. Bactine is a really wonderful wound cleaner. And then over here we have a Blood-Clotting Spray. This came with the bag. The bag originally came with a kit when I bought it, and I just basically added my own stuff in here. So a lot of this stuff is stuff I've added in here. Very little of it is original to the kit. I also have regular bottle of rubbing alcohol there, and also some normal saline for washing wounds. Tends to come up a lot. Then I got basically kind of the BLS trauma section here. That's your 4x4 gauze pads and Curlex for wound packing, or for bandaging, and that's kind of your most basic American Red Cross first aid bleeding control. And then back here I got all my gloves, just kind of shoved on the top of all my burn stuff there. So I mostly treat minor burns, so I have a little bit of Allocaine in here, and some hydrogel burn spray. That's for the superficial, or what used to be called first degree burns. And then we also have burn dressings in here for treating the different kinds of burns. Alright, and then of course you could probably figure this out yourself. These two are kind of just general purpose pouches, and then obviously red is trauma and green is airway. So I'm going to pull out the airway one first. We got a Berman Airway Kit in here with I think it's 6 different sizes of oropharyngeal airways, or OPAs, and there's also a set of MPAs in the green pocket in the back. I'm not going to pull all of that out. And I also have a Ambu CPR barrier in there, which has the infant and adult barriers. So that's my quick access for CPR. And of course, also for CPR purposes on this side, in the exterior pocket, I have bag valve masks, readily accessible, adult and infant, of course, for quick access for CPR. And then red pouch, obviously, is the trauma kit, and this one I will open up. It's pretty stuffed in there, as you can see. Let's see, turn on the light. Yeah, alright, so we got my cat tourniquet, Gen 7, North American Rescue. There is C-Locks, Z-Fold wound packing gauze, as well as non-hemostatic wound packing gauze in the back. We have both 4 and 6 inch Israeli bandages and granule syringes. I know a lot of people don't like the granules, but in some cases I will use them. We also got quick clot bandages here, and this is the tourniquet that came with it. It is not very good. It's kind of like a little IV tourniquet. Sorry for all of you watching. Yeah, there, see, it's kind of a little one-hand IV tourniquet. Not great for stopping bleeding. Definitely not TCCC approved. A lot of you probably know that TCCC came out with new tourniquet guidelines, but that is definitely not in there. And there's also this clear occlusive dressing back here that came with the kit. That's supposed to be their chest seal. And then I have actual chest seals in here as well. So there you go, there's the trauma kit. Then my yellow bag, that is all my vitals equipment. So I have a report style dual head stethoscope. Also have my BP cuff, or as I can and no one else can pronounce it correctly, sphygmomanometer. And then we also have a pulse oximeter in there, and a little under the tongue temperature gauge in here, right there, a little under the tongue temperature gauge, and thermometer covers, and also extra pieces for the stethoscope. And there's the pulse oximeter. Very useful little kit there. Use that a lot, especially on my asthma kids. I do carry a few medications for the troop. You know, we have aspirin here, obviously, for heart attacks. I keep track of all my dates for everything. There's both full aspirin and there's child aspirin in here. There's Benadryl for allergic reactions and stuff. Mostly I just kind of let the parents that are along give that to their kids. You know, like that. But it's the same medications you'd have in your cabinet. And there's loratadine 10 milligram for allergies. There's ammonia ampules, smelling salts to wake people up, sting relief pads that I just keep in here because it's a good place to keep them. And of course your standard pain medicines, Advil and Tylenol, normal NSAID type stuff, anti-inflammatory, fever reducers. Nothing major in there. It's common household over-the-counter medications, and it's there really for the scouts to use, for the adult leaders to use, because sometimes the kid gets a headache and stuff, and so we are allowed to give them certain things. And then we have here in the front pocket, this is all the quick access stuff up here. You know, the things I use a lot. Basic first aid stuff, you know, Band-Aids, ointment, alcohol wipes, all in here. 2x2 gauze pads for minor bleeding, alcohol wipes, and betadine, providinidone. There's the moleskin and mole foam. Mole foam is for already occurred blisters. Moleskin is for preventing blisters. Eye patches, steri strips, and small bags of Celox strips. And then we also have sterile cotton tip applicators, and as well as the wooden tongue depressors as well. Those are packaged as well, and I have a couple not packaged for use as finger splints, and also for use as tongue depressors, what they're designed for. Multi-purpose, really. And then, of course, I have some betadine, propidenidone swab sticks. They're already pre-coated, and I've used those a few times for cleaning out wounds. And some extra Q-tips that I can soak in stuff. I do carry triple antibiotic ointment for really nasty cuts, but as a good doctor once told me, you can see the hydrocortisone cream gets much more used than the triple antibiotic does, and that's because a good doctor once told me that hydrocortisone cream is so much better because of the antibiotic crisis. I do have artificial tears and MediFirst eye wash as well for any types of eye injury, dry eye issues, object in the eye, stuff like that happens sometimes out of camp. Basically, this is basically the same thing as Bactine here, just first aid spray. Extra pens, pencils, marker for triage. Then we got all of the Kelly hemostats down here. Regular scissors, Dollar Tree doggy poop bags. Y'all gonna laugh at me, but these things are the best when you're doing first aid, especially out in the middle of the woods or anywhere really, and you don't know what to do with all your trash. They carry these they carry something like this on the ambulance, basically a big trash bag that they carry in their medical bags to throw away all their medical waste. Well, I carry little ones to throw away all my medical waste. I've never really needed much bigger than that. Of course, Trauma Shears Quick Access and EMS Vital Statistics notebook by Right in the Rain, so I get blood on it and whatever, and it'll still work. I got different kinds of tweezers for pulling splinters, no clue how often that happens, and of course, a good old-fashioned glass breaker seatbelt cutter. And then I got my pupil gauge and another marker over here, and this is my favorite pair of tweezers. Got a magnifying glass and a light on it to help you see those little splinters, and it's a lot more successful than any other pair of tweezers, but sometimes the head on there just doesn't have enough grip, which is why I have different kinds of tweezers to grab, and of course more sterile cotton swabs for cleaning wounds. And then the last pocket, of course, is the side pocket over here. Pretty simple over here. Nothing too major. We've pretty much covered most of the stuff. We got our basic first aid stuff, life-threatening bleeding, CPR, taking vitals, medications, trauma, burns, random injuries, diabetic emergency, shock, all of that's covered. And now we have over here, this is our musculoskeletal section, so all of our breaks and sprains and things like that. There's 2 SAM splints in here, an actual SAM splint and one that came with the bag. I also have a little ice pouch in here, so this can be filled up with regular ice. That was from Dollar Tree. It works great, especially when you're out at like summer camp or something like that with the Boy Scouts, and you need long-term, these are one use. Well, this is multi-use, so for long-term care. Icy hot patches and stuff for musculoskeletal injuries, very important out there at camp for people with sore muscles. And of course, we have finger splints. We have some actual finger splints, and there's also a SAM finger splint, and right there, right behind those. Some muscle rub cream. There's different sizes of ACE wrap from 2 to 6 inch, so 2, 3, 4, and 6 inch ACE wraps. Of course, we have our disposable cold compresses and tons and tons of these triangle bandages. I like to have a lot of triangle bandages. So, I plan to have at least 3 triangle bandages for 1 broken bone. So there's actually 6 triangle bandages in here, which is enough to use both SAM splints on an ankle injury or an arm injury. So that's your wrapping up your SAM splint, creating your sling, and your swath for arm injuries. And then, of course, wrapping it in 3 locations with a nice soft triangle bandage. You could use gauze, but for me, I've tried find triangle bandages are so much more comfortable for the patient. Depending. So sometimes I'll use gauze to secure it better. Sometimes I'll do this because it's more comfortable. Sometimes I will use a little bit of a combination of both. It really depends on patient preference, comfort, and the situation at hand too. As well as how long it's going to be applied and things like such. So pretty much that's it. That's my medical bag. Pretty simple. It handles most of what I need. I've never encountered a situation outside of emergency medicine that in the civilian world where this bag could not handle the situation. I've been fortunate enough to never have to use my BVM off duty. I have had to do CPR before, but never had to use my BVM. So that's pretty good for me. It was actually an unfortunate situation where I did not have this bag with me. But I did have a pocket resuscitator mask like the one that's in here that I carry in my EDC bag. So that's pretty much it. And I'm recording this video for 2 of my different channels, Eagle Scout Prepper and also for my gaming channel, which is for all you folks out there that I don't want you to know my name or my face. So that's it, and I'll see you in the next one.